Dear friends, today I am going to discuss about the cholesterol. As we know, cholesterol is important to keep our body cells healthy, to keep intact our nervous system, to synthesize certain hormones in our body that requires a certain quantity of cholesterol. But at the same time, high cholesterol level is problematic. High level of cholesterol can cause narrowing of the blood vessels, and those blood vessels which supply heart, that is the coronary arteries, brain, that carotid arteries, or kidney blood vessels, that is called renal arteries, and other part of the body also gets affected by the deposition of the high cholesterol, and that lead to narrowing of the blood vessels. Suppose a blood vessel of the heart gets narrowed due to deposition of cholesterol, calcium, and other circulating cofactor in our blood, that will lead to either partial or subtotal or total occlusion of the blood vessels, leading to a slowing of the blood supply to that segment of the heart or brain or kidney or limbs, and that will lead to ischemia. Suppose if our blood vessels get clogged and total occlusion suddenly, that will what will happen? That will cause total jeopardization of the blood supply to that segment of the heart, leading to heart attack. If that occurs in brain, that will lead to a stroke, that is called paralysis. If it occurs in kidney, partial occlusion lead to high BP and further deterioration of the renal function, leading to end-stage renal disease, that is kidney failure, and finally requiring renal transplant in some cases. If cholesterol deposited in your limbs, that limb blood supply will be reduced and leading to the claudication of the limbs. So cholesterol is problematic. Today, as we know, we have number of evidences that cholesterol is harmful in excess of cholesterol in the body. And what is the cholesterol? For a particular person, it should be individualized. And what are the factors associated with the high cholesterol? That is, the most important is our bad lifestyle, unhealthy lifestyle. We most of the time we are not doing any physical activities. That is, physical inactivities is the most important factor, along with our diet, poor diet. What is poor diet? Diet rich in saturated fats, red meat, animal products, and full fat dairy products, fried items, junk foods, and processed food containing the preservative and all that will cause high level of cholesterol. And obesity, if we are obese, then our cholesterol will go high. Diabetes is a major risk factor for coronary artery disease. That means the occlusion of the heart blood vessels, or carotid, yani occlusion of the blood vessels of the brain and kidney blood vessels. So in diabetes, itself a major risk factor for that disease. But along with hypercholesterolemia, that is high cholesterol level, and if person is a smoker, smoking with all these factors can cause high chance of high degree of blockade of that blood vessels. If you are a smoker, if you are a diabetic, if you are suffering from hypertension, if your cholesterol level is high, then you are at very, very high risk. If you are not doing proper physical activities, if you are taking a large quantity of alcohol, if you are involved in, you can say, in the diet, unhealthy diet, whatever we discussed earlier, then risk of heart disease, that is heart attack, or brain stroke, that is the attack, paralysis, or kidney failure, or limb ischemia, that is limb or blood vessel compromission due to high cholesterol is very, very high. Then you ask, what are the symptoms of high cholesterol? As I said, high cholesterol has no symptom. You have to get your blood parameters done. If in the report your cholesterol is high, you should see your treating physician or your doctor or cardiologist. Then you can ask, sir, when to get our blood test done. It should be done if you are at high risk. Who are the person at high risk? Those with family history of premature coronary artery disease, those with the history of hypertension, those with the history of diabetes, those who smokes, they are at high risk and obese. And in that situation, blood lipid profile should be done before 35 years of age. Normally, we ask to get it after 35 years of age. Sometimes if one of the cause of high cholesterol is genetic. In that situation, it's a hypercholesteremia runs in the family. In that situation, even in the earliest 10 years of or 20 years of the life, you have to get lipid profile done. And that is important to assess. And doctors, if prescribe some medicine, you should follow, you must follow to keep your blood cholesterol level at the target level, so that your life will be event free. So high cholesterol must be treated accordingly if your doctor prescribes, and you should know the high cholesterol is now number of medicines along with lifestyle modification. You can reduce your cholesterol level to the desired level, and you can prevent your heart from suffering from the heart disease or heart attack or brain attack, that is a stroke or paralysis or kidney failure or limb ischemia. Hypertension has got no symptom producing like that. Once organ that is called target organs like brain, heart, eyes and kidneys once involved, then hypertension produces symptoms. Like that, cholesterol has no symptom. If the organs are damaged, then you will get symptoms. So cholesterol should be checked frequently if required at the interval of 6 weeks to 3 months, as your doctor or clinician prescribes. You should follow that advice. And what are the symptoms? Then you can ask for the heart problem or kidney problem or brain problem. If suppose if you are walking or climbing up a stairs, if you are getting pain, that is indication of atherosclerotic heart disease. That might be due to demand supply mismatch. So you should be aware of that. Now you may ask, sir, how to bring down, how to keep cholesterol level down? If you are doing exercise regularly, at least 30 minutes a day, most of the days of the week, suppose 150 minutes per week, brisk walk, not leisurely walk, brisk walk is recommended. If you are taking healthy diet, that means you are avoiding saturated fat in diet, you are avoiding full fat dairy products, your dinner is light, you are taking a green leafy vegetables in plenty, fresh fruits, seasonal fruits, and avoiding red meat, and quitting smoking, reducing your weight, that is obesity is the one of the risk factor for hypercholesteremia. By reducing your weight, you can keep your blood cholesterol level down. By controlling diabetes, as I said, diabetes directly affects your heart, kidney, brain and eyes, but along with cholesterol, its risk is very, very high again. So diabetes per se affects cholesterol level. So blood sugar control is mandatory, hypertension control is BP, high BP controls should be in proper way to the target level. Quit smoking, do regular exercise, avoid unhealthy diet. If you are taking alcohol, alcohol should be in moderation only, not in the large quantity, and do some yoga and meditation. Relax yourself. Stress is also one of the factors involved in the cholesterol. Always remember, heart attack is preventable. Heart attack is preventable just by controlling your cholesterol level, by controlling your blood sugar, by achieving target blood pressure, quitting smoking, healthy, sticking to healthy lifestyle, and improving diet, alcohol in moderation. By doing some stress relieving exercises, you can protect your heart and you can prevent your heart attack. Thank you.